to order at 6 p.m. Thank you. And your name is? Alan what? You're recording. Chris Lepak's recording.
I'm recording as well.
Chris Kelleher's recording. We have a sign-in sheet. Okay, the first topic on our agenda tonight is an executive session using exemption number 1 to discuss the reputation, character, physical condition, or mental health rather than professional competence of an individual, or to discuss the discipline or dismissal of or complaints or charges brought against a public officer, employee, staff member, or individual. This is a hearing to appeal the citation for violations of Chapter 2 of the State Sanitary Code 105 CMR 410 at 44 South Maple Street. The individual here tonight is Robert Barnes, and you are going to be accompanied by a representative, your daughter? Right.
I'm gonna sit with Bob Barnes through it.
You're his representative?
If you still want me to.
He wants you to be your
does.
representative? Okay. Rich Chafee. Okay. And do you wish to be in executive session or open session? Executive?
Do you want to be open? You can have an open if you want.
He said it.
Executive?
Executive, okay. So it's going to be, okay, it's going to be an executive session, so do I hear, and I also need to just announce that after the executive session is concluded, we will be returning to open session, so everyone will have to leave while we are in executive session. We'll close the doors, and then we'll open those doors again to invite everyone back in following the conclusion of the executive session. So I hear a motion
I'll make a motion that we go into executive session, we reconvene into open session.
for the hearing to appeal the citation for violations of Chapter 2 of the State Sanitary Code for 44 South Maple Street. Do I hear a second?
A second?
We have to take a roll call vote, so you state your name and then
Kim Simons, aye.
Christina Verdella, aye.
Maureen Lepak, aye. Okay, we are entering executive session. There can be no recording other than the individual who we are discussing. Everyone needs to leave the room now. Now. Are we back on? Okay, so moving on to our next agenda item is the Leicester Regional Public Health Coalition permitting and inspectional updates for the month of January. Michelle, you had said that you would provide those to us, so it's for you.
Good evening, everyone. I'm Michelle. I'm the regional health director for the Leicester Regional Public Health Coalition.
Put your mic on.
Thank you. And yes, so for the month of January, I'm going to provide a few updates towards the month of December and January. So we have a new septic received for 32 River Street that is under construction. We completed a septic for 14 Rice Corner Road on January 14th. We've issued 3 hauler permits for, and I'm going to say names and I'm going to butcher the names, Dumont Septic Pumping, Slims and Berthuium Sewer Services, Inc., and Dumpster Services. We have issued 1 installer permit, and that would be for Gabriel Berthien or Slim and Berthien Sewer Service, Inc. And we have a permit pending for Richard Schaff, which is Schaff Constructions, if that's the
What is
right-
it?
Chafee.
It's Chafee?
Yeah.
Shaft. Chafee. See, I said I was going to butcher the names. We have issued 1 food permit for Pups Pizza, and we have 5 pending. Do you want to hear the 5 pending?
No, we don't need to
okay.
really hear the pendings.
Perfect.
We'll just-
And then we have conducted some inspections on 26 Allen Road. Plain view inspection done on January 21st. No violations observed. Lincoln Street extensions, plain view inspections done on January 21st. No violations observed. 41st South Maple Street, plain view inspection done on January 21st. And 1 Draper Street, Unit 2, inspection done on January 6th.
What was it? 1?
1 Draper Street, Unit 2. And we've done only 1 perk at 2 Gay Road on January 6th.
Tupelo?
I'm sorry,
Was it Tupelo?
2 Gay.
Oh, Tugay,
G-A-Y.
I'm sorry.
And those will be it for permitting and inspection. Yeah.
No, there's no public comment tonight, I'm sorry. Yeah. Yeah. Please don't speak. Please, I actually said, can you please not?
How do you get access to the executive?
There's no public comment tonight. There's no public comment, we're in session.
We were just wondering.
You can ask after the meeting. There's no, I don't know, but we're in public, we're not in public comment, excuse me. You have to leave. Yes,
Excuse me, I'm just saying. I thought
you are not allowed to
after we close the
speak.
meeting,
You guys
isn't
have-
it
you
supposed
have
be
to
open
leave.
then for an additional meeting addressing the same topic?
No,
No.
no.
So there's no results from that executive session available?
I'm moving on, and you're not allowed to speak.
For that?
I'm not speaking, we're not having public comment. I've told you 3 times. If I have to tell you again, I have to call an officer to have you removed, so please go.
You're very important. I'm so
No, it's no public comment.
so impressed
Yeah,
with
you,
your
yeah,
power.
okay,
You're absurd.
all right.
Yeah, all right.
It's so weird. It's
I
supposed to be
know.
a town, it's like a town meeting and then this is.
All right, so on to the next,
Those muscles.
excuse me.
Flex those muscles.
All right,
It doesn't.
can I see the sign-in sheet? We're gonna have an officer.
It doesn't really make sense.
We're breaking the law now.
All right. Yeah. All right, so that was probably orchestrated. All right, so we're gonna move on to the, yeah. So, moving on.
Okay.
Did anyone have any questions on the report?
inspection.
Okay.
Thank you.
Okay, so the next topic is the Mass Health Officers Association Tobacco Control Memorandum of Understanding to conduct inspectional services. So if you recall, at our last meeting, we had voted to delegate MHOA as an agent to conduct inspectional services for tobacco control. And so this is the, I'm just looking for my folder for that. It's right over there. This is the memorandum of understanding. That we need to sign in order to allow this organization to do those inspectional services. So I sent this to KP Law for review. I haven't got comments back yet. They have reviewed this several times for other towns, but I did hear from Michelle that they do have some comments, and so they'll be providing them. I wanted to give you guys a copy of it to read, but I would suggest that we defer signing this until we get our KP feedback and then have it on the next agenda. So we're going to just defer that. Okay. You agree?
Yep.
Okay. All right. The next topic is the board review of the the MHOA model template, which was updated on January 6th for local regulation of tobacco with town council's input. So if you recall at our last meeting, I distributed the new template for you guys to review. In tandem to that, I reviewed the KP Law reviewed it, and they gave some feedback. So you'll see a printout from Brian Riley on comments that they had provided. So I'll give you a minute to kind of read through that.
Because it says it's color-coded, but.
It is, but I don't have a color, well, we don't have a color printer. I have one here. I have it in my house, but I really can't. 18 pages, make multiple copies of things on my printer. So what you see is the difference is that's like, you can kind of tell that highlight, and then that dark is the green.
Okay.
What we probably should do here, if that front page, if you look at the front page, they have a checklist for policy decisions. And based on our answers for those policy decisions, that will sort of reflect whether we're taking the yellow or the green, if that makes sense.
Say that one more time.
So the checklist for policy decisions, we kind of go through and make, we'll go through and decide yes or no on some of these things. And that basically tells you, for the most part, whether to adopt the yellow or the green or neither. Because the yellow highlighted sections are language copied from the latest state law and Department of Public Health regulations. So I think actually those are pretty standard.
Like in this document? Not
In the
this
document,
way?
yeah.
Okay.
Well, it's the whole document. This is the whole template, right? So they gave you a checklist at the
Yes.
top, which will go away when we finalize the regulation. So the regulation starts on page 1. This is page 0. And as you go through it, there's some areas that have highlighted sections. I also posted this online, so you could see it from the last meeting. So that you can see it yourselves on your own computers in color. So they have language, the green language is highlighted sections are uniquely local policy decisions. So just a correction. So based on the decisions we make on the checklist, it'll tell us whether or not we're adopting the green highlighted sections. And the yellow highlighted sections are language that's like from the state, the latest state regulations, so that for the most part, most towns have to update their tobacco regulations. We don't have a local regulation on tobacco. We're supposed to have one. And so we're putting this in place. So I think the easiest thing for us to do is to understand the feedback from KP Law, which you have in this document. And then he also provided this e-update. It was the Supreme Judicial Court upholds Board of Health enforcement of Massachusetts flavored tobacco ban. So that's just information for you. So he's got he's got a little bit about those cases in his email. And then on different pages, he sort of gives some commentary. I don't think he's really changing, but he's just explaining some of these various policy options. Okay, so that makes sense? Okay. So going through the checklist.
When you say it's posted, it's on the town.
I put it on under our meeting from last meeting because I said I would. Okay. And so it's there, but I know it's hard to read. I just don't have ink and paper, and I actually ran out of paper tonight, so this town doesn't have a color printer. So looking at the checklist for policy decisions, one of the things we can choose is if there's no permit renewal if outstanding fines exist. I feel like that's an easy yes. We wouldn't want to renew a permit
Right.
if there was an outstanding fine, right? All right, so I think we can agree there. I think we should go through the checklist and then we can make a motion at the end to adopt the answers. You know, I think it's good to just go through and talk it through. So the second is no permit renewal if 3 sales to persons under 21. I would, again, I think that's kind of an easy yes. Some of these get a little tricky though. So no sales to the following persons, select one. They have 2 things in the state. They have what's called a nicotine-free generation. So basically, some towns will prohibit the sale of tobacco for people born after a certain date. The other option is any person under the age of 21. So I'm inclined for any person under the age of 21 versus trying to, you know, dictate to adults, you know, what they do. I don't know. What are your thoughts?
Is the age 18?
No, the age is 21.
It is for cigarettes, for nicotine?
I think so. It's the state law
That's what
under
this is,
21,
yeah.
yeah. So we have an option, 21.
Yeah.
Or-
nicotine-free generation. Yeah, I would say
That
21.
sounds nice, but I say we go with the state law.
It's like, yeah, it's like, I don't feel like
State.
these are adults.
I guess it's changed.
Yeah. No new permits within X number of feet from a school, and they give you options, at least 1,000, because that's the rule. I think it's optional, like, right? Like we have the option whether or not to give a permit, to deny a permit within so many feet of a school. So there's a yes, no. And then if yes, they offer 1,000, 2,000, 3,000 or more, and you put in. So that seems to be in 1,000 increments.
I would say yes.
Do we want to give no new permits within so many feet of a school? Because we have 2, I think,
Oh, no new
places.
permit. Right.
We have 2 places that are near the elementary school that sell cigarettes, but it's the elementary school. I'm trying to think this out. Like, it's really hard in this town because of just the proximity to the elementary school to downtown, basically. I think the fear is that the kids are going to go into a place and purchase cigarettes underage, and I just think elementary school kids are not going to be able to pass themselves off as easily as a high school kid. So the high school is down by Sturbridge, and the middle school is down by Sturbridge, and then that's a resident, like there's no businesses down there. So I'm not sure I would want to adopt the number of feet within a school.
Well, nothing's saying somebody couldn't on that side of town. It's like an old groomer buildings right there. No.
So let's,
You know,
let me just look at,
Commercial, right?
let's just look at number,
Right.
I wish they put the
I don't know
page
what's
number
going
where
on.
they were, I wish they put the page
They're
number.
working for something there.
All right, so section
That's
8,
close
hold on one
to
second,
the school, and it's in Brookfield.
hold on. Section 8. Section 8. They don't give you the where they're talking about in the document. Let's see what he's got. He doesn't give us any feedback about the school. Michelle, do you know if they are referring to no new permits or like so grandfathered to people who had, or is it, because permits are issued every year?
Yeah, I think it'll be easier for boards of health to say new permits rather than grandfathering, because then you're like
Right, then
keeping
you
track
don't
and all
know,
that
yeah.
stuff.
So on that basis alone, I don't know that I would say yes on here myself. What do you think? That would like, there's like two of like the three places are like right here near Town Hall.
So, just in case it could be a gray area and people think it could go for a renewal, or just,
Well, we just wouldn't,
wouldn't
we
matter,
wouldn't,
right?
we wouldn't make any statement to whether, how many feet it can be within a school.
and then the next one's within an existing, so that's probably a no, right? Because there's two right there.
Of an existing retailer, I don't know. Let's just get through number 4, though. What do you, yes or no, first of all? What are you thinking?
I would say yes.
Only because I'm thinking of something else. There is a feet restriction. Marijuana.
That's 500 feet. And I'll tell you, through this whole document, marijuana and tobacco are treated very differently by the state.
No, I know, but I'm just.
Like, there's
it's
fines
just
for
something
tobacco,
pops
the
in my head.
tobacco that are very, like, to me, very high. So like, without a state regulation, the most we could fine somebody, like, for nuisance or something like that is $1,000. The state requires us for tobacco violation, the first offense is $1,000, the second offense is $2,000, and the third offense is like $5,000. So it's like, there's a disparity between how the state views these two products. So as much as you might want to try to make it even,
Not necessarily make it even, but it's just,
I get you, I hear it.
yeah.
I just think that in doing so, you would be telling two businesses today that sell tobacco, they will no longer be able to sell tobacco. And that will leave just one
Well,
place
that's what I thought
to
you
purchase
asked her to
tobacco.
clarify. Was it new or?
Like she was against
say-
grandfathering,
I
right?
was
Yeah.
against
Right.
grandfathering,
Yeah.
but just any new,
No new permits, the permits are issued every year.
but any new
So that's what it would
construction.
be, when you reapply every year, not that you've already had one, not like
Right,
different from a new,
right.
that's what I thought you were
Right,
clarifying.
every year, yeah. That's what she said, right?
Yes, so any
Yeah.
new, like, say, they
So
ended up
business has
opening.
been in, so like Cumberland Farms in town, they've been here forever.
Yeah.
So every year they apply, that's considered new.
That's a renewal.
Oh, a
that's
renewal,
what-
new
yeah.
versus renewal, okay.
Yeah, I would
right,
say
see.
like a new, as in like, if they're
brand
coming into
new
town, they're
store.
building a whole Nura or
Yeah.
Shell station, or
Okay.
whatever the case is. That's what we say. Because
Okay.
renewal is renewal, but any new construction, or I'm taking.
I guess we'll
construction.
just,
Isn't that the difference between number 4 and number 5? Number 5 is of an existing retailer, and number 4 would be
no,
of a new one?
no, it's like not to have them too close together.
Oh, okay, of the retailers being.
So like
It's-
someone couldn't come in on the other side, like say
Competitor.
home craft sign and put in a place because it's too close to the school and too close to another retailer.
Okay, yeah. Now I'm
I see,
tracking.
okay. So no new permits with, so I just have to say, well, I'll highlight this word renewal to make sure the text has clarification on that, because that confused all of us.
So what do you mean, you don't want it to say renewal?
Well, no, I just, if we use it, I want some wording within the document
Okay.
to clarify what the difference between new and renewal is, right? So that people understand.
Right.
It's not the annual
Correct,
as a
yeah.
new permit. Okay,
Yeah.
okay. All right.
So I still
So
say
yes?
yes.
Okay. And then 1,000?
I'm so bad with feet.
I think 1,000.
Yeah, 'cause
I
then-
mean,
Yeah.
okay.
that's enough. Okay.
All right. No new permits within X number of feet of an existing retailer. I don't see why we're gonna,
Yeah. I'm gonna say no.
what do you think?
Yeah, it's such a small town.
Yeah, I tend to agree. Okay, so we'll just hit the no button on that one. Cap and/or reduce number of permits, simple cap, reducing caps. So do we want to cap the total number of permits we issue in town?
That's simple versus reducing. I don't know what that means.
Michelle? what's-
Cap meaning, I don't know how many permits you have in town, but say you're capping it as 30 and no more than 30. So once you reach on the 30 number of permits that you have for tobacco, then if someone wants to come in and wants to apply, they won't be able to apply because you're already
Or you
on
have
the
a cap?
But
But
what's simple
what's simple versus reducing cap?
Simple versus reducing cap. Oh, say if you don't have any, because you clearly don't have any regulations at this point, so I think I will just say capping it. But say if you did have a cap, you want to reduce the cap to, instead of 30
For
to
less than what we
15.
have?
Yeah,
Okay,
yeah.
okay. So I think a simple cap. Okay. If we do it, and so do you think we should do a cap?
They have them for alcohol.
They have them for marijuana and alcohol, so why not tobacco?
Yeah. Are you gonna ask what the number is? Because I don't know.
Yeah,
I think right now, there's what, like 5? There's probably 4 or 5 places.
I've only heard of 3 that sell
There's
tobacco.
Dollar General,
Dollar General,
Cumberland's,
Both liquor stores.
Cumberland's.
So 4.
Somebody hasn't been getting a permit,
Central,
Oh,
so somebody's,
selling without a permit.
yeah, if you're counting more than 3.
Right.
Mhm.
And then the red store.
All right,
Across the
so,
street, that's across the street from,
oh, the other liquor store.
right.
Yeah, so I count 4.
can you relay that to Mackenzie?
What are the ones that have not been?
I mean, I am assuming
out.
both liquor stores are selling.
I don't know, I haven't been in them,
know.
so I don't drink, so I don't know. I don't
The
go
2
there.
liquor stores? Is there any, I mean, I can ask Mackenzie, but,
We'll figure that one out.
okay.
If they're selling without a permit, I'm not inclined to give them one, I'll tell you that. Well, not that we do, but I would say throw out a number. 5?
I was thinking 6, but.
I'd say 5 too.
Okay.
Let's do 5. We're going to do a public hearing too, and so we can get feedback from people at that public hearing, and then we can adjust, of course. But yes. This is just to help us get the draft going, so then we can hold a public hearing. Ban smoking bars. We don't have any smoking bars that I'm aware of. But would we ban them? Do a lot of towns ban them? Yeah.
Oh, really?
I don't even know what it is.
Like, you can go in,
Just-
similar to like, there are a lot of towns that do that. So before the state law.
Would it
came
be
in-
a same as a hooker law, like the
A hookah?
hookah?
No, so it's like, yes,
That's a-
similar
is
to
that a
that.
different?
Yeah, yes.
Would that fall
yes,
under?
Yes.
If they couldn't have
Yeah.
that?
Yeah.
Huh.
A lot of towns do it, and we're a very small town.
But like if someone wanted to come in and put in a cigar shop,
You can't sit there and,
You can't sit and smoke.
right?
yeah.
that it's a business I would want or support, but it is not.
I don't know why, I don't feel inclined to ban it, but I don't really know
No,
much
that's what I'm
about it. I
saying, I
mean, we can revisit it. I can circle no for now, and then we'll see what the public says, and then, you know, if there's support for it or against it, you know, we can kind of go from there.
I know nothing about this next one, so I don't.
Include minimum cigar package, size, price. There's language in there, so we would go to the green text, so that's what's going to tell you. This is just like helps so I can formulate the draft. This is going to take a couple of rounds, obviously. Include minimum cigar
Deciding what
package
that's like.
size,
I'm just saying this
price.
is minimum, not maximum.
Yeah, I don't really know. Well, we'll kind of circle back to that one. Okay. Oral nicotine pouches, and these have very specific languages. So maybe, okay, so back to the number of permits. He did give some feedback on that. The page includes language limiting the number of tobacco sale permits to be issued in town. Such a cap is valid. The Board of Health will need to decide on the number. It makes sense to put that number based on businesses that currently sell tobacco legally, and then establish a waiting list for any new businesses. I think that's fair. Okay. And then, so, I think he's saying here for page 12. Let's look at if I'm correct here. Wait, let's just go to the text. So we're in the cigar sales regulated. Why they picked green, it's like, no retailer or person shall sell or distribute or cause to be sold or distributed a single cigar unless such cigar is priced for retail sale at $2.90 or more. That's that they're trying to limit like people just buying a single cigar. Okay, so or you can select two at $5.80. This section shall not apply to a person or entity engaged in the business of selling or distributing cigars for commercial purposes to another person or entity engaged in the business of selling or distributing cigars for commercial purposes with the intent to sell or distribute outside the boundaries of town. Well, that doesn't probably apply to us, but the Board of Health may adjust from time to time the amount specified in this section to reflect changes in the applicable consumer price index by amendment of this regulation. I really don't know the background in this.
I don't either. To me, it sounds like you're encouraging more cigar
Yeah.
sales that you can buy.
Yeah, I don't really
nips.
understand it, yeah.
It's just a waste of money.
So maybe we just say
So let people
no.
waste their money and buy nips. That's, I
So
don't
we'll
know.
just,
Discourages it, right?
I don't know.
I don't
I'm sure it's aimed to discourage, but oral nicotine pouches, I guess we don't have to apply these, so, but you can restrict the sale to adult-only retailers or prohibit more than 6 milligrams of nicotine per pouch. I'm not familiar with these products.
But don't you want adult retailers only? Anyway?
Yeah. Hold on, I'm just trying to. Oral nicotine pouches. I guess it would probably be a store like it's a smoke shop that's only for adults versus like a store that other people go to. Why don't we,
I don't know. It's
I'm gonna,
weird.
we could hit the yes button and then kind of hear from people in the public at the public hearing. And then that way they have the language in there to either, if they disagree or agree, and we can research it further in the meantime.
Sure.
So I'll just keep it in the, basically it helps to keep it in the template, because if when, on the ones that we say no, we're basically taking away that language. All right, so ban blunt wraps. What are blunt wraps? I don't even know.
I don't know, I say yes, it's how you roll your own. Pot or tobacco. Do the wrappers, you know?
Mm-hmm.
I know.
I don't smoke. I don't know.
I don't either, but.
So on page 11.
All right, page 11.
It doesn't.
It just has, there's no detail. Okay. I don't know what they are, so before I say anything, I would like to find out what they
Isn't there a
are.
definition? There's no
Huh?
definition?
Well, they might be, actually, I don't know.
Then there is.
Definitions are not very, there's not a lot.
Wrappers.
Blunt wrap, okay. Any product made wholly or in part from a tobacco product, manufactured or packaged with loose and removable leaves or a section of a leaf, or as a hollow tube, which may be used by the consumer to wrap or contain loose tobacco or other fillers.
If they don't get them here, they can get them somewhere else. So it's literally paper that you can smoke.
Want to say no?
Yeah.
I don't think we have to ban it.
No.
No? Okay.
I'm going to say yes to banning free distribution of tobacco.
Yes. You agree?
Ban free distribution of tobacco?
Are you get your mic's on, right? I don't know. I can't tell if you can hear you or not.
I can hear me.
I know, but we just need to make sure people can hear.
So yes to 11?
I agree.
Yes.
Yeah. Ban redemption of coupons.
I didn't even know they exist.
I'm not gonna go there.
Yeah, I wouldn't.
Ban self-service
Yes.
displays. Yes. Yes.
Yes.
Yeah.
Ban tobacco product sales in educational institutions. He did have some information on that, and I think that's seems like, no, they were actually for the health institutions.
I'm going to say yes.
Yes, okay. Do you agree, yes?
Yes.
Okay, so. Fining structure system, separate state and local fines or one set of fines? I think one set of fines seems like fining structure.
Yeah, I would just go with the state, right?
Yeah,
Clear cut.
Yeah.
okay. Tolling period for local violations, state level at 36 months or over 36 months.
Stick with the
Stick with the
state.
state. Choose suspension periods. First violation, 1 day, 3 days, or 7 days. Second violation, 3 days, 7 days, or 14 days. And third violation, more than 7 days, 14 days, or 30 days. I feel like the higher number, like if you're only getting suspended for a day,
Right. What do they care?
The
Is it-
incentive
for
to
such a
follow.
small day.
7, 14, and 30?
Yeah, I would say that
I
too.
agree.
I agree. And shall versus may language for suspension. So we talked about this before.
I did read what he said.
Mm-hmm.
I think I agree. Because it does leave it more up to the agent.
Yeah, changing it to may rather than shall.
Yeah.
The Board of Health retains its authority for a stern penalty if merited, but also to evaluate how serious the violation might have been. Yeah, I think that's, you agree?
To do May?
May?
Yeah.
Yes.
Yeah, okay. All right, so for this topic, I think everyone agree on that? We want to hear a motion that I'll update the document with the language based on the policy decisions to get a cleaner copy for review next meeting?
So moved.
So moved. Okay, motion,
Second.
ML. To next meeting. Any further discussion? All in favor?
Aye.
Aye. All in favor? Okay, so that one's done. Okay, so that was the big one. 2025 transfer station fee schedule discussion. I updated the transfer station pricing. There's two things. I was looking at our contracts with the vendors and noticed that we are being charged more for disposal of tires than we're charging customers. So we're losing money in the town for everyone who discards a tire. So you'll see in the new document versus the old document, you get two. You get the cleaner one is the one I made. This one, the one that looks Xerox is the old one. All right, it says as of March, I put in for March 1st since it's right here. I could bring this down to the transfer station on Saturday. And then December 2021 was the old one, right?
Yes.
So there's two things. So the first one I bolded was the tires. And the only other one is that Casella has increased. So we're being charged more than $100 for mattresses. So it's an extra $5. And this goes up every year of our contract. They like add a couple of dollars. So it's what's contracted. So we just have to match the cost of what Casella is charging us. So I upped that one, which is going to be a bummer. It's already such a pain that it's $100. It's now $105, but it'd be nice to, somebody else would be able to, we'll have to continue that search. I feel like there's got to be a better solution out there somewhere. But in any case,
Yeah, 'cause
right now, the town's losing money on these items because of the cost is actually higher than, and I don't know about some of these others. I think we have some time to kind of keep looking at this, but I'd like to get a motion to approve.
It was $20 is all we charged?
Oh, before.
Oh.
Before. Yeah, this hasn't
So
been
they
updated. This is an
jumped up, or-
It was $100 after the state made the requirement. There was a new law that went into effect like a year ago.
Yeah.
And the price went
But
up.
we've only been charging 20.
Before, no, we've been
Oh.
charging 100, but
Oh,
this
okay.
needs to be updated. It
Oh,
was,
okay.
I had to download it and convert it, and then I ended up having to hand type it. It's such an old document that it
Yeah.
was impossible, so I just sat down and did it.
yours
So
looks
it's
way
a little
nicer.
easier to work with now, but yeah, so
Yeah.
it would be a $5 increase on the box spring and a $3 increase on the tires. So if I hear a motion to approve the updated transfer station pricing as of March 1st, 2025,
I'll make a motion that we adopt this new document as of, for the Brookfield transfer
seeking
station
motion, updated pricing,
as of
to
March
approve
1st.
updated pricing.
To approve the updated.
So just, get a habit.
So moved.
You can, but you can take time to write down the motion before you say it. You don't have to formulate it. You just formulate it and then make the motion, and then it's easier. So you're motioning.
Repeating what you said.
Can you, all right, don't get me off track. So, a motion to approve the updated pricing
For the,
for March 1st, transfer station pricing. Okay, let me just. You made that motion, second?
Oh, I second.
Okay. Sorry, here we go. Any further discussion?
no.
All in favor?
Aye.
Aye. And I'll send that document over to the communications committee, and they'll update the website with the new document, and then I'll bring it over to Jim on Saturday so that it can be posted at the transfer station as well. All right, that's that. And then Board review of marijuana establishments review plan, application and fee schedule document. This has been a couple of months now. Did you guys get time to review and determine if these fees seemed reasonable compared to other towns? Michelle, you're the one that actually provided this template. I had asked this question of you, so what are your,
Honestly, I mean, it's a very small town. Those are like more like cities.
Yeah.
I will say like, even with the Natick one, we'll say around the 3,000. I was looking at Webster's marijuana's permit as well. It ranged between 200 and 300 on.
to Webster? So it's still around the same, yeah.
The ones I really found were closer to Boston,
Well,
but
I think it's not so much geographical for the people, it's more of like what a health agent charges to do the inspections. You know, it's a lot of work involved in working with the company to review their plan and then do the inspection. So that cost is based on that. And so I was just like, I'm thinking, so looking at like $200 is probably 3 or 4 hours of work for a health agent.
For plan reviews? Or even for inspections?
Well, I would imagine it goes in hand. That's what we're charging them.
Plan reviews can take a little longer, just because you're reviewing the plans and you're communicating and.
Well, I wouldn't want to raise it more than what we see
Yeah,
here.
no,
So
I wouldn't
I'm like,
either.
so
Yeah.
this has to cover it, so. But we also have to consider, this is like à la carte.
Yeah.
So you're a cultivator and then you have a, manufacturer, they're going to be checking off 2 boxes, but it's still like hopefully one form, because the form allows them to check off, right? So hopefully that, extra work isn't so much extra. There's different things that the agent has to review and look at and different permits to review and documents, but that would be contained in the total. So it's just like our food plan, our food establishment application, where they check off, what applies to them, and then they submit their check, and then the agent goes and works with them on the review, and then issues the permit. So just so it's clear to you guys, like, we're not voting on this, like, when someone applies for this is just like we do any other permit, right?
Right.
Like, we're not putting these guys through a different process.
No.
They're gonna go on the same kind of process that like a food establishment would have, working with the agent. So is there anything, did you see anything on this document that you thought was problematic or that you wanted to change?
I did not.
No?
That looks good to me.
Okay, and so you think that, I did change one thing, I thought it was a typo. One said it was a marijuana I think it was the micro business or the cultivator. I can't remember, but one said 320 and then it said for the annual operating permit, it was 320 instead of 230. I think that was a typo on the thing that you gave me. I don't see why an initial plan review for a cultivator would be 230 and then we jump it up to 320 for their annual permit. So I just fixed that. I think that was a typo. So I changed it so it was consistent. So they're basically all the same. There's a little extra more for manufacturing, a little less for research, much more for medical, but I think there's a lot more involved in that. So
The initials over the annual for a couple, like the research facility, like the initials less.
yeah.
Oh, because one is just the plan review and then one is for
Yeah.
the permit. Okay.
Yeah, yeah. So, any further discussion on this?
No.
All right, do I hear a motion to approve the marijuana establishment, marijuana operating plan review and permit application and fee schedule?
I make a motion to approve the marijuana operating plan review and permit application with fee schedule.
And I second.
All right, any further discussion? No. All in favor?
Aye.
Aye. All right, that one's done. Getting there. All right.
changed your template.
I did, it's reviewing the minutes. All right, so I had sent these out, trying to make it so it's not so many pages, so you had given me that feedback, so.
Looks good.
Wait for Kim. Almost.
Is this correct?
No, you're right. All right, I'll make that's a typo.
Okay. Change 6:30.
So the
Oh,
time,
right, six.
yeah. So I can make that correction on the final.
Just one number.
Yeah, I know. I have new glasses. My glasses are ready to be picked up. All right. So do I hear a motion to approve as amended?
So moved.
Second.
All in favor?
Aye.
Aye. Motion to adjourn?
I'll make a motion. We adjourn at 10, 11,
7-Eleven.
or 12. I don't know. I can't.
7-Eleven.
7:12. Motion to adjourn, 7:12, we'll call it. Okay, yes, second?
Second, yes.
All in favor?
Aye.
Aye.